Okay, folks, welcome to spring weather in Flagstaff. Classic. You went outside today and you're like, I put shorts on and a t-shirt this morning, and then hopefully you brought a jacket because now it's snowing. Classic Flagstaff, right? Couple of schedule reminders. So we're in peripheral nervous system today. You've got quizzes 9 and 11 due Friday by 11:59 p.m. I know many of you have already gotten those done. And in lab, this week you're kind of finishing up with lab 9, axial muscles, head, neck, and trunk, right? And next week you're in lab 10, which is brain and cranial nerves. And then you go straight into special senses, because lab kind of finishes early in the semester, if you guys noticed that. But cranial nerves, brain and cranial nerves, you'll be well prepared for that. And then we'll do nerve physiology next week here. Then we have our exam, and then our last unit is over unit 5, special senses. Okay, so lab and lecture are kind of doing this, right? Just to let you know where we're at. What kind of fruit has the most electricity in it? Watermelon. Yeah, agreed. I have an agreement right here in the front row. What did the baby corn ask the mama corn? Where's popcorn? Nicely done. Wow, you're on a roll over there. What does a backward cow say? All right, that was not so good. that one, no matter how you lay that one out, it's just really not that good. Okay. So we're in the second lecture of peripheral nervous system. There are some materials today that are basically just, you got to memorize it. Flashcards are great. Attending SI/TA sessions is great. Repetition is great. We're going to talk about different types of nerve fibers. Does it surprise you that there's different types of nerve fibers? Okay, you've seen the movie, the bad guy leaves a bomb, and the good guy gets there, and there's like 2 minutes remaining. They don't have any bomb squad experience, maybe a high school diploma. They're in the wrong place at the wrong time. There's a girl that's in distress. They happen to be on the phone with the bomb squad, and they're the only one that can actually defuse the bomb. And there's like, you're going to have 5 wires. I want you to cook the green wire. He's like, the green wire? The green wire. I mean the black wire? No, the green wire, right? You know what I'm talking about? So there's different types of wiring that do different things, just like this analogy. So it shouldn't surprise us that there are different types of nerve fibers, and they're going to do different things. And they're going to be signaled in different ways. They're going to have different neurotransmitters. They might be organized slightly. Instead of like green and black casing on the wire, or the red wire with red casing, they might have a long fiber that innervates onto a short fiber. So there's going to be different variations, just like in this sort of horrible action movie I just described, right? So that's kind of the backdrop of what we're going to talk about, because a lot of students kind of wrestle with, well, why do we have these different fibers? Well, they do different things. Okay, but before we go there, let's talk a little bit about some review. The parasympathetic division does what? Before you even answer this question, tell me what it does. Just tell me what the parasympathetic nervous system does for us. Let's back up. It's the calming system. I actually really like that. That's good. It's very simple. Language like rest and digest, feed and breed. You'll see that in different texts. Slows things down. Okay? What does the sympathetic nervous system do? Fight or flight? Give me some specifics. Increases heart rate. Thank you. Increases heart rate. Adrenaline stimulates the sympathetic nervous system. What else? I mean, these are great ways to study. I've had a lot of students come like, I need some study tips. This is a great way to test each other. Yes. To where? To the skin. It reduces blood flow to the skin and to the GI tract because it's not time to digest a meal. Once the exercise gets going, you might, increase perfusion to the skin for the sweat response to cool off the body for homeostatic reasons. Okay. I just had a thought for a second because I was thinking about the news. Did you all hear about Booker's filibuster? 25 hours. You guys hear about that? They broke a record. Aren't you grateful that lecture's only 65 minutes or an hour 15, 75 minutes? Huh? Can you imagine a 25-hour lecture? Whew. I can't. I don't know what that looked like. So fortunately, I mean, we might have finished a little bit early today. We are not going for 25 hours, but Booker sure did. All right. That was just some current events for y'all to stay up to date because I know your noses are in books. So now let's talk about parasympathetic division. Answer this question. What does it do? Does it decrease blood flow to the skin? Huh? No, we just said that. What does that? The sympathetic nervous system mediates many reflexes that regulate digestion, urination or urinary and reproductive systems. I'm liking that one. Let's finish reading the question fully, right? Because I've been asked, like, I need some test taking tips. Well, here's a tip. Read the question carefully. Read all the answers. Okay, tip number 1. Is responsible for the fight or flight response? No, that's what? Sympathetic nervous system. Okay, great. Causes an increase in metabolism? No, that's what? Sympathetic nervous system. All of these. Well, it can't be that if we've already said no to a few, right? Feeling pretty confident about B. What do you guys think? Yeah, that's the right one. Inevitably, my exams, not all the questions are this straightforward, right? You get down to 2. And you're able to eliminate, and you're down to 2, and you lean towards 1 initially because there's some reason you feel like that's more correct. And I talked to one of your colleagues today. We looked at the exam sort of together. Mostly they did. And we concluded that they would have done significantly better if they would have stuck with their initial answer. Because they went back and they changed a bunch, and they had it right the first time, but they second-guessed themselves. There's actually a lot of data to suggest that when you get into that testing environment, the anxiety level goes up. There is sort of a subconscious reason that you're drawn to, if you're legitimately not guessing, like you're eliminating answers. But let's say E was something that seemed kind of close, right? But you're feeling really confident about B, and so you're like, I'm really confident about B, but now I just read all the questions and I don't know about E. Well, go with your high confidence then. Is it a guess? Yeah, it's an educated guess, and you have a reason that you're choosing that one. And then don't be tempted to go back, reread it, unless you have new information. Oh, I read the question wrong. He's asking about the sympathetic nervous system. I read it completely wrong. I got to start all over. Does that make sense? Okay. People are getting up early. There's a clock running, right? It's intimidating environment, and you second guess yourself. That is real life. But part of the training for the future is being able to be in those environments and being able to perform. So I want to try to help you get to a place where you're more comfortable taking exams. Now, are you going to be taking exams the rest of your life? Depending on your profession, you will. Okay, maybe not as frequently. But even in the real world with no quote unquote exams, you're going to be tested for your resolve and your ability to perform under pressure. That's what a job is. Okay, so is a testing environment exactly translatable to real life? Not exactly, unless you're taking the boards and then you've got to do continuing education or you continue on in your professional training. But making tough decisions about what you know under high pressure is extremely relevant. Okay, so I know we don't love the exams, but working with you to try to help you figure out how to get more comfortable doing them It's kind of part of my job. So come see me. Ask the TAs, ask the SI, because they've got a lot of experience doing exactly that. And that's one of the reasons we have these in class, is I do these types of things. Okay, now I want you to, on your tablet or a piece of paper, I want you to draw picture A and I want you to draw picture B. We're going to come back to it. Picture A is a presynaptic neuron with a long axon, and it synapses onto a postsynaptic neuron with a short axon. So it's like a green wire that's connected to a red wire, right? Picture B, it's just the opposite. It's a presynaptic neuron with a short axon synapsing onto a postsynaptic neuron with a long axon. So long, short, and then short, long. And they don't have to be very complicated drawings. It could be a line with like a bifurcation, and then a ganglion, and then a line. Does that make sense? So a line, a branch pattern like this, a circle colored in, and then a line. Picture A, it's a long one, and then a short one. In picture B, it's a short one, and then a long one. Does that make sense? Really simple. Okay, we'll come back to that. But I want to know, I kind of want to test to see, like, from the audience, like, who actually looked ahead. Which one of the drawings, A or B, is of a sympathetic pathway? A or B? Sympathetic pathway. Any guesses? Sympathetic is short to long. That's right. So short to long is B. Well done. This is kind of that red wire, green wire explanation, right? Why is it that way? Well, it kind of just is. That's how they designed the bomb, right? They decided, the bomb designer said, let's make the bad wire the red wire. I don't know why it's always the red wire, right? So B, we'll come back to it. So save that. Now I want to ask this question. Which neurotransmitter actually does the autonomic nervous system most commonly use? You know, another way of saying this is, you know, in bomb design, what's the most utilized wire? Right? It's probably some garden variety wire. Okay. So what's the most commonly used neurotransmitter in the autonomic nervous system? What is it? Acetylcholine. And so these fibers that release acetylcholine are called, they release acetylcholine. So they're called cholinergic fibers because they release acetylcholine. Do you kind of catch the right way I'm saying it? I'm enunciating certain syllables so that you can think about it carefully. Cholinergic fibers are the most abundant. They're the wiring that we most commonly have in the autonomic nervous system, and they release acetylcholine. We've seen acetylcholine before in the muscle physiology unit, and we know that acetylcholine esterase, abbreviated ACHE, is the enzyme that breaks down acetylcholine. Now, acetylcholine is found in both the sympathetic and the parasympathetic nervous system. So here's an example of where I didn't change it, right? So this is saying parasympathetic and sympathetic. We'll see a lot of that in this lecture, a lot of SNS and PNS. We're in the peripheral nervous system, but here in these slides, we're talking about the parasympathetic nervous system. It's found in both, but it dominates in the parasympathetic nervous system. So now we kind of need to get into different types of cholinergic receptors. So if you have a cholinergic fiber and it releases acetylcholine, the acetylcholine has to bind on a certain type of receptor. Now, we actually looked at an acetylcholine receptor in skeletal muscle. And so we're going to look at two different types of cholinergic receptors. That's not the only kind that there is. We're going to look first at nicotinic receptor, and then secondly, we're going to look at what we refer to as muscarinic receptors. So nicotinic receptors are typically excited or stimulated by acetylcholine binding. You can see the example of skeletal muscle. So the receptor that's the acetylcholine receptor on the postsynaptic side on the muscle that we learned about in the muscle physiology lecture is a nicotinic style receptor. I didn't tell you that back then. I'm telling that to you now. You're going to find it in skeletal muscle. You'll also find it in the adrenal medulla, and you'll find it in the autonomic nervous system ganglia. And it looks like this diagram that we have up here where, whoops, sorry. You can see the nicotinic receptor in the membrane. This should be kind of a flashback to the skeletal muscle system where we've got acetylcholine binding, it opens a channel and sodium comes in. That's exactly what we saw in skeletal muscle. So you already have seen a nicotinic receptor. We just didn't call it that back then. Why do you think we call it a nicotinic receptor? It's not a trick question. Maybe it has something to do with nicotine? Maybe. What do you think? Nicotine actually also stimulates this receptor. It responds, this is what nicotine stimulates. Okay? So they're named for their research discovery of nicotine binding to this receptor. They'll call them nicotinic receptors. But it's a type of acetylcholine receptor. Okay, the second one is muscarinic receptors. Now, this one's a little bit more complicated because now we're getting into different categories like M1, M3, and M5, which are all odd numbers. These are all stimulatory muscarinic receptors. So when acetylcholine binds, it stimulates it through the release of calcium inside the cell. Stimulates it just like this. Instead of sodium coming in, we get calcium release. So muscarinic, stimulatory, when they're excited, it excites like the intestine. It excites glands, smooth muscle, and cardiac muscle. Calcium release would make sense with smooth and cardiac muscle because that stimulates muscle contraction. But there are some inhibitory activities like M2 and M4 variations of muscarinics, which we see in cardiac muscle, where we'll inhibit the cardiac muscle with that muscarinic. Now, this receptor is called a muscarinic receptor. This is a little bit more challenging. Does anybody know where this root comes from, why we call it a muscarinic receptor? Compound is muscarine. Where does that come from? Muscarine, any ideas? It's actually found in a mushroom toxin. Okay? So you could actually harvest this mushroom toxin, and if you gave it to an individual, it would actually stop their heart rate. Okay? So certain mushrooms are not good to eat. Okay, another question, exam style. When the parasympathetic division is stimulated, what neurotransmitter is released at the effector organ? What's the one we've been talking about? Okay, acetylcholine. Thank you. All right. Now let's talk about our second variation of fibers leading to receptors. We're going to talk about adrenergic receptors. Adrenergic receptors. So adrenergic. Where do you think this gets its name? Adrenergic receptors. Adrenergic receptors. Adrenaline receptors. What are the compounds that we refer to as adrenaline and noradrenaline? Epinephrine and norepinephrine. Is that helping to make these connections? Adrenergic. So I was with another one of your colleagues today, or a few of you were in there, and I said, okay, this is a tough class because, and I said this at the very beginning of the semester, but I mean, we don't use words like this because these are like Latin words. Like nobody walks around talking about, their adrenaline receptors, their adrenergic receptors. We understand what adrenaline is because we kind of commonized that word, right? So understanding the root words and making these connections might help you remember. And that's why I'm doing it this way. So nerve fibers that release norepinephrine are called adrenergic fibers. And receptors that respond to norepinephrine are called adrenergic receptors. So we've got two different types. We've got the alpha type and we have the beta type. So let's focus on the alpha type first. Alpha type, we're utilizing noradrenaline, which is the cousin of adrenaline. It's a neurotransmitter. Alpha 1 and alpha 2. So we have noradrenaline. You can see the noradrenaline release. This typically excites, which should make sense, right? You have noradrenaline is going to stimulate alpha 1 and alpha 2. If it's an alpha 1, it's going to cause vasoconstriction. That means the blood vessel has a wall of smooth muscle in the middle part of the blood vessel, and it causes it to vasoconstrict when it's stimulated, alpha 1. Alpha 2 causes smooth muscle contraction throughout the body. Okay? Could be smooth muscle contraction of the vessels to assist the alpha 1s, but you have smooth muscle in other locations, like in the esophagus, you have it in the GI tract. So alpha receptors, remember, they're stimulated by noradrenaline. They cause this smooth muscle cell contraction. Now, beta adrenergic, over here, this far right pathway, is the complicated one to remember. But I'm going to give you an example that hopefully will help. So beta adrenergic receptors, typically norepinephrine is going to have an inhibitory response, which is kind of contrary to what you might think. The exception is actually the heart muscle. So over here, the beta 1 variation, you get a stimulation of heart muscle contraction, but you get a beta 2 on smooth muscle relaxation, like in the bronchial, the airways, or in blood vessels. So beta 2 relaxes the airways when it's stimulated, but beta 1 increases the heart rate. So let me give you a practical example that you could write down here. How many of you have asthma or know somebody with asthma? Okay, great. How many of you have seen those inhalers? Maybe you have one. How many know what a nebulizer machine is? All right, great. This is a very, relevant, apropos example. Individuals that take a nebulizer treatment or like 17 hits of that inhaler, okay? The whole idea as a beta agonist to stimulate the beta adrenergic receptors, it binds to your bronchial airways and dilates them. But it's broad-based. It doesn't have just specificity to beta 2s. It's a beta stimulator. So it also activates beta 1s and causes the heart rate to do what? Go up. So that's one of the side effects of patients that take a nebulizer treatment and they have kind of a racing heart rate afterwards. Does that make sense? Some of you know what I'm talking about because you've used it yourself. I've experienced that with a nebulizer every now and then. So that's how a beta agonist works. Okay, here's another example. You have a patient that has a heart condition. You don't want their heart to work too hard. They're close to heart failure. They had a recent heart attack. They have high blood pressure. They're under a lot of stress. What could you do to throttle how hard their heart works or their heart rate? What could you give them pharmacologically? Not a nebulizer treatment, right? That might kill them, actually, right? And that's a contraindication. Like, if you're going to be a nurse or a future pulmonologist, like, you need to know your patients carefully to make sure they don't have a heart condition before you give a nebulizer therapy. What could you give the patient, just think outside the box for a second, to throttle so their heart doesn't work too hard? Any ideas? Circle up. Ask your neighbor. Who's got some ideas? A blood pressure medication? Okay, that's a good guess. Any other ideas? That's exactly right. A beta blocker. Okay, so look out, folks. You're doing pharmacology right now, and this is why you have to understand these pathways, right? So if you had a drug that you could synthesize that had specificity to a beta 1, and you could make it an antagonist and block the beta 1 response, you would actually lower heart rate. And that's exactly what we give to our heart failure patients, are what we refer to as beta blockers. They're beta 1 blockers. And the next generation asthma medications are beta 2 agonists to try to minimize the side effects on the heart. And that's the next generation of drug discovery. Does that make sense? I know you probably have heard of a nebulizer, probably used one. You know what I'm talking about, the racing heart rate. And you probably know people that are on beta blockers, or you've heard of them in the news. That's exactly how this is working. Okay, so let's take a peek at locations of cholinergic and adrenergic fibers in the body. Well, if it's on the sympathetic division, on the preganglionic side, it's always cholinergic. On the postganglionic side, it could be either. It's mostly adrenergic, but sometimes it's cholinergic. If you're a parasympathetic variety, on the preganglionic side, it's always cholinergic, and on the postganglionic side, it's also always cholinergic. Okay, so that's kind of the wiring pattern that we have in the body. Okay, so let me ask another test-related questions before we go back to our drawings. When norepinephrine, are we talking about adrenergic or cholinergic? Norepinephrine. Norepinephrine is what? Noradrenaline. Are we talking about adrenergic or cholinergic? Adrenergic. Norepinephrine binds to a beta adrenergic receptor on the bronchioles, air tubes in the lungs. That's what that is. You'll learn more about these in 202. It's most likely binding to which receptors? Beta 1s or beta 2s? Or you can't tell? Beta 2. We just talked about this. Okay. So I want you to go back to this drawing, and I want you to label on the parasympathetic side the nicotinic receptor, the muscarinic receptor. I want you to draw on the sympathetic pathway, the nicotinic receptor, the adrenergic receptor, and there's a different variation of a muscarinic. Okay, so give it a shot. Should be super easy if you looked at the slides. Or if you did the reading, you looked ahead like I strongly suggested. Just give you a few minutes. The adrenergic and the cholinergic fibers is kind of what I meant by memorization, right? There are some clues based upon word association. And then these pathways are also part of the memorization that I've been alluding to. You just need to spend time with this material to remember how it's organized. I still see people drawing, so I'm gonna wait. We've got time, and then I'm gonna give you the answers. Okay. So if you're there and you're paused and you're like, okay, that was super easy, Keller. Give me something else. I want you to capture the different neurotransmitters that are in each synapse in your pictures. And if you're totally stumped, that's okay. This is great homework. This could be a flashcard, right? You can make a series of flashcards, like you're standing in line for your taco. You can just look at your flashcards. That's what we used to do before social media. We used to study in line. We're kind of ready for the first picture of a parasympathetic fiber. Are we ready? Who's still kind of going and wants me to hold off? Okay, I don't see any strong objections. No bookers in the audience. They're going to talk for 25 hours. Parasympathetic fiber. Right? Cell body with a line with a bifurcation. Cell body with a line with a bifurcation and then a target cell. Very simple diagram. You don't have to be, some of you are like, I can't draw. That's why I'm going into science. Okay? This is not complicated drawing. Put a couple of dots in the first synapse, acetylcholine, a couple of dots in the second synapse, acetylcholine. This is a parasympathetic fiber. That's a nicotinic receptor there, and that's a muscarinic receptor on the target cell. Long, short. Very straightforward, but you just kind of have to memorize it, right? All right, we ready for the sympathetic fiber? I mean, this is recorded, so if you're not done drawing, you can always go back to the recording or look at the lecture slides, look at your textbook. We have two variations of a sympathetic fiber because we have an adrenergic variety up top and we have a cholinergic variety down low. But the motif is the same. It's short, long, short, long. So in the sympathetic adrenergic fiber, which is most of these types of fibers, they're the sympathetic adrenergic variety, they secrete norepinephrine onto an adrenergic receptor. And this is the most common of the sympathetic fibers in the body. Less common is a cholinergic variety where you swap out the receptor here as a muscarinic receptor that receives acetylcholine. So acetylcholine here, norepinephrine here. Acetylcholine here, acetylcholine there. Most common, less prevalent. Okay? So there could be some questions on the exam about what neurotransmitters are coming from which fibers, which receptors do they bind to. Likely a question, some clinical correlation question about what happens if you give a patient a beta blocker or an inhaler. What are you worried about, right? Pretty straightforward. Why do we have these different variations? Why do we have these different variations? What's the purpose of having them? We spend biological energy making not just all acetylcholine at the first synapse and norepinephrine at the second. Then we go through the energy to make a different variety with the muscarinic receptor on the sympathetic cholinergic fiber example. Why? What's the purpose? Different functions, different variety, different levels of control, right? You know, the best example is you saw with beta 1s and beta 2s. Not all betas are the same. So you can do something specific on the heart that's different from the bronchioles in the lungs. And understanding that as you move on, if you go into research or you go into clinical medicine or you go into patient care, that level of specificity is how we get to navigate the human body and help people, right? You got to understand how to do that and not hurt people, right? You don't want to give a beta agonist to a patient in heart failure. I mean, that would be horrible. Okay, during a fight or flight response, which type of receptor on the piloerector muscle responds to the released neurotransmitter? Remember, that's the muscle in the skin that makes the hair stand up. So it's fight or flight. Let's dissect the question. Is that sympathetic or parasympathetic? Sympathetic. So we're on the sympathetic side. We're exciting the pathway. What do you think? D, it's not D muscarinic. So remember that so it's not D muscarinic. The beta adrenergic are inhibitory, right, for bronchodilation. And the exception is beta 1, which stimulates heart rate. So that kind of rules out C as well. So now you're between A and B. It is A, alpha adrenergic receptors. Right? These are the ones that have the excitatory effects. I know. So some of this is going to take some time to study so you can kind of navigate these questions. All right. In the remaining time, it's going to get a little bit simpler. Okay, so you can kind of take a deep breath. A little bit simpler. We're going to put into some practice here some real examples of innervations and how they work. And then we'll finish up with kind of making some connections back to the central nervous system. Because we're in the periphery, but the periphery doesn't act all by itself. It's doing things to either inform the central nervous system or the central nervous system is executing through the peripheral nervous system. Okay, so let's talk about tissues, some examples that have dual innervation. You know, we hinted at this on Monday. Now, the viscera is a great example, has both sympathetic and parasympathetic nervous system innervation. And when they work together, it's considered cooperative or agonistic. When they work against each other, or one turns up and one turns down, one increases or one decreases, we call that agonistic. And we kind of talked about that with the beta blocker example, right? We've already kind of gotten there. But I want to give you two more examples. One's an eye example, and then one is a saliva formation example. The first one with the eye is antagonistic, meaning the sympathetic nervous system is going to do one thing, the parasympathetic nervous system is going to do the opposite. So let me explain. If you look at this diagram, true to what I mentioned, the central nervous system sends a signal to the superior cervical ganglion via sympathetic nerve fibers in yellow, right? This is the yellow wire to our sort of bomb example, right? The yellow wire goes and innervates onto the muscle of the pupillary dilator. And it causes this to open. You contract the muscle, and now the pupil opens up larger with sympathetic innervation. This is using adrenergic stimulation of the pupil dilator muscles under sympathetic nervous system innervation. Let me ask this. Why would you increase the size of your pupil, allowing more light in, under sympathetic activity? Why? Visual acuity. That's exactly right. Fight or flight. You need to know, can I see my predator, right? Or can I see my enemy that I'm about to go toe to toe with? So the stimulation to the dilator muscles around the pupil under sympathetic outflow triggers an adrenergic response where you open up the amount of light that comes in. Okay? Agonistic, the opposite. Parasympathetic fibers, this is after the ocular motor nerve, cranial nerve 3 that you're going to learn about next week in lab. The ocular motor nerve goes to the ciliary ganglion, innervates to the same tissue, it causes constriction. This is parasympathetic outflow, cholinergic stimulation. Different nerve, colored blue, the blue wire, cholinergic pathway versus adrenergic pathway causes pupil constriction. Parasympathetic, rest and digest. You're slowing things down. You're probably going to close your eyes in a minute, so you don't need a lot of light. This is a practical example of an antagonistic dual innervation. Does that make sense? Okay, let's look at agonistic effects with saliva. So the saliva, it acts on different effector organs for a common goal. If it's the parasympathetic nervous system, again, to remind you, this is not the peripheral nervous system. This is, in this lecture, this is parasympathetic nervous system. That stimulates water secretions. Water secretions. The sympathetic nervous system makes mucus and enzymes for digestion to stimulate chemical breakdown. All of this is happening in the mouth. Now, let me ask this question. Have you ever heard of users of meth and the kind of side effect of meth mouth, right? So what does meth do? Well, it stimulates the sympathetic nervous system, causes bruxism. Bruxism is the clenching and the grinding of your teeth. How many future dental hygienists in the room? Yeah, okay, this is what these next pictures, they're sort of graphic. You might want to turn away, okay? They have poor oral hygiene. They have under salivation because they're making a lot of mucus and enzymes, but they're not making a lot of fluid. Does that make sense? Because meth ramps up the sympathetic nervous system, kind of gives these patients almost like super energy. And so hyposalivation, you get a lot of enzymes kind of sitting on the teeth, and it results in this deterioration of the teeth and the gums. That's what's going on. Okay, so now, is dual innervation the only way that we can regulate out in the periphery? What do you guys think? Yes or no? Is it the only way? No, it's not the only way. It's great to have dual control, right? But let me ask you this question. If you needed to slow down your vehicle, could you do it without your brakes? Yeah, what's the first thing that you do? Take your foot off the gas. Perfect. Okay? Eventually you'll stop, okay? Or something will stop you. But you don't have to have a brake in order to slow down, right? So that's kind of the justification here is it's a little bit less biologic energy if you can build the pathway, or if the pathway could be designed where you don't need dual innervation. So in some circumstances where it works, the design, the blueprint is not to have dual innervation. It's to have just single innervation. And the example that I'm using here is one that we've been referencing in this lecture vasoconstriction and vasodilation. You'll get into this in 202, so this is foreshadowing into the cardiovascular section. But vaso meaning vessel, constriction meaning the smooth muscle in the wall of the vessel contracts and it narrows the opening. And that's a situation known as vasoconstriction, this first top image. Vasodilation is that smooth muscle in the medial wall of the blood vessel relaxes and the vessel dilates. That's called vasodilation. Now, you control vasoconstriction and vasodilation under different circumstances where you have different types of activities. Like, for example, we talked about the sympathetic nervous system. We shunt blood away from the gut and we shunt blood away from the skin. Shunt. That means you move it, you decrease the flow to the gut and you decrease the flow to the skin. How do you do that? You vasodilate or vasoconstrict? You vasoconstrict. You close the opening. So regulating blood flow via vasotone is really important in our body. And we do it only by sympathetic nerve innervation. So you only use a gas pedal, for example. So you can see this is the artery in red, if it's confusing to you, and the yellow is a nerve. And see these little black hash marks that come across the nerve? That's a symbol in neurophysiology, and we're going to get to there next week. That's a symbol of an electric impulse, or what we call an action potential. So when you have these black hash marks, they're really close together, and there's many of them. You see down here how there's fewer and they're further apart. So we're sending more signals here saying, give me vasomotor tone of vasoconstriction and contract that muscle. And then down here, you just say from the brain, decrease the number of impulses, take my foot off the gas, and this vessel is going to dilate. So that's an example of controlling a target organ with single innervation, just the gas pedal. Okay, it works very, very well. So if it works really well, let's just use it. And that's kind of the design. You just had lunch. You're beginning the process of digestion. Which type of receptor in your heart wall responds to the release neurotransmitter? This one's a little challenging. So are we sympathetic nervous system or are we parasympathetic nervous system? Parasympathetic. How do you know? You just had a meal. That's exactly right. You just had a meal. This is food coma. That's what we call food coma, right? It is muscarinic D. Well done. Muscarinic. Okay, so these are the kinds of questions that you need to prepare for. So in the remaining few slides, and then we're done early. Okay, and you can go play in the snow. If there's any, you can kind of like, use the 1-inch accumulation and make a snowman. Maybe a little mini snowman. So let's integrate some of this stuff. Like, what controls this autonomic nervous system, which is out in the periphery? What controls it? Somebody, tell me. What controls the autonomic nervous system? Does it control it on its own? Well, it's automatic, Keller. Yeah, it controls it on its own. No, where does the control come from? It comes from the central nervous system, but specifically where? You can just read the slide if you need to for a refresher. Okay, so let's do that. In the cerebral cortex, we have centers like the limbic system that connects conscious thoughts with the hypothalamus. And what does the hypothalamus do? Do you guys remember what it does? Oh, it's conveniently listed right here. Homeostatic things like hunger, thirst, temperature regulation, emotions, rage, pleasure, sexual desire, right? So we're linking things from the cerebral cortex, specifically the limbic system, to the hypothalamus. And then we actually connect it to the midbrain, to the pons, and to the medulla oblongata. And remember, that axis from top to bottom, from rostral to caudal, remind me that axis, how is it organized? Rostral up top, caudal down low. How is it organized? Higher thought processes where? On the top, or rostral. Caudal, tail, is what that Latin word means. That's down low. That's the brainstem, right? Now we're in the pons and the medulla oblongata. And so we've got cranial nerves that you're going to learn about at great length next week in lab. And we've been hinting at it over the last few weeks in a couple of different units. And you can see the pupil constriction example we talked about today. That's oculomotor nerve 3. We talked about the salivary secretions. That's facial nerve, cranial nerve 7. We talked about salivation and blood pressure. That's glossopharyngeal nerve. That's cranial nerve 9. We talked about the thoracic and abdominal viscera on Monday. That's the vagus nerve, cranial nerve 10. And then also on Monday, we talked about the connection to the spinal cord, where we have control centers of defecation and micturition. And I showed you the micturition reflex. Okay. Last question for today, I promise. The following is dominated by parasympathetic activity. Increasing heart rate, yes or no? No. Sweating, yes or no? No. Digestion. Okay, I like that one. What's the tip though? Read all the questions, right? Pupil dilation. Oh, that one's a tough one, Keller. I'm kind of stuck between C and D. Parasympathetic. What's the input on pupil dilation? Parasympathetic constricts. What causes dilation? Sympathetic. Why? Why was the why behind it that we said? Fight or flight. You want to see better. Visual acuity. So I know it's not D. Let's go with C, right? Okay, I agree. C is the correct answer. Well done. All right, have a nice weekend. Stay warm out there. I'll see y'all on Monday.